Through various assessments including the overhead squat, single leg squat, Ober test, Thomas flexibility test, and goniometry measurements, the most common overactive muscle remains the tensor fasciae latae, while the most frequent underactive muscle is the gluteus medius structure. These muscle discrepancies have led to a presence of iliotibial band syndrome, otherwise known as runner's knee. The following video demonstrates the utilization of the corrective exercise continuum and how NASM can successfully improve such compensations within the kinetic chain. Some of the checkpoints to look for in the anterior, lateral, and posterior views of the overhead squat are at the knee, ankle, and foot complexes. We are looking to see if the feet turn out and flatten, and if the knees move inward. These movement compensations in the overhead squat can help us see other overactive and underactive muscles besides the TFL and gluteus medius that need to be targeted to help improve these overall muscular compensations. During the single leg squat assessment, we are interested as to what happens at the knee complex, looking to see if the knee moves inward. Again, this can help us distinguish other overactive and underactive muscles besides the TFL and gluteus medius that need to be targeted in order to improve overall movement mechanics of the body and create more muscular balance within the kinetic chain. The Ober test is used to assess the flexibility and overactivity of the TFL. It also helps the trainer narrow down exercise selection after performing a movement assessment such as the overhead squat. The client will lie on their side, ensuring the kinetic chain is straight and continuous. This is where the trainer will ensure the spine is in nice alignment. The client will lie on the edge of the table closest to the trainer, ensuring the pelvis is in this alignment. The trainer will place their hand on the pelvis to maintain proper alignment in this area. The other hand will grasp gently at the knee complex that is stacked upon the other, ensuring the lower leg is caressed by the trainer's forearm. The bottom leg will be maintained in a bent position. This is where the trainer will put their top leg into knee flexion, pull it into slight extension, and watch to see if the leg falls back into adduction. If the leg is unable to fall back into adduction, this is a positive Ober test for a tight overactive TFL structure. This is where we would ensure to lengthen and release this tight muscular tension of the TFL. Phase 1 of inhibition is utilizing myofascial release, or SMR. Within the first phase of the corrective exercise continuum, the client is performing myofascial release using a foam roller upon the tensor fasciae latae to release muscular tension in this area. The following exercise variables will be applied within the program design. A set of 1 with myofascial release happening daily. The client will hold on the tender area for 30 to 90 seconds. Within the proposed program, the client will be holding upon the tender area for 60 seconds if levels of pain and discomfort do not disallow participation. So we're going to do SMR of the TFL, which is found to be overactive in runner's knee. So what we're going to do is we're going to do one set of 30 to 90 seconds. So for this particular program, we chose 60 seconds. So I'm going to show you first how to do it. Okay, so what we're going to do is we're going to take this foam roller right here. You're going to foam roll the TFL muscle, which is the pocket muscle on the front. Okay. So if I just get you to step aside, you're going to come down onto the foam roll. This leg's going to come right in front. Okay. For support, this arm down on the ground. You can rest on the elbow. I want you to find that really tender spot. Okay. You're going to hold it there for 60 seconds. Okay. All right. If there's any pain or discomfort, we want you to stop. Alrighty. Can I use this? Yes, definitely.
Yay! Sorry, should I not talk? Okay. Okay. Sorry, I kind of don't shut up.
Alright, so this is going to bend a little bit more. And then you're going to put this arm right on your leg. There you go. You're going to roll until you find that tender spot. I got it. And you're going to hold it there for 60 seconds. So as we said, Melissa's only going to do one set. And then we'd switch and do the other side. In phase 2 of lengthening, we are utilizing a static stretch regime. During the lengthening phase of the continuum, the client will perform a static stretch for the tensor fasciae latae to further relax the overactive structure before moving towards the strengthening portion of the regime. The following exercise variables are employed. A repetition count of 2 reps per side to be performed daily. The duration of the stretch will be 20 to 30 seconds. We are utilizing a 30-second hold to optimize the benefit of the stretch. Okay, Melissa, so now we're going to do the lengthening portion of the continuum. Okay. So for this one, we're going to stretch out that TFL muscle after we have just done myofascial release. So what I want you to do is you're going to take your right leg forward. It's going to point straight ahead. And you're going to take this left leg and slightly rotate it outwards. All right? All right, so you're going to take your left arm straight up into the air, bend over to the side, and slightly up towards the ceiling. Okay, so Melissa's going to do 4 sets. So she's going to do two sets on each side and hold each stretch for 30 seconds. About 20 to 30 seconds, but we're going to say 30 to optimize the benefits of the stretch. And then we would switch and do the other side. This is phase 3 of activation. The isolated exercise utilized during this activation phase is the lateral walking leg abductions with external rotations. The client will step outward into a side-stepping leg abduction and work the leg up into an external rotation at the end range of motion. The exercise variables applied within the corrective continuum are as follows. 2 sets per side. Normally a 10 to 15 repetition count is applied. For our program, we are utilizing 14 repetitions. A frequency of 3 to 5 times per week is applied. For our program, we are utilizing 4 times per week. And finally, a 2-second isometric hold at the end range of motion will be applied to the exercise, with a 4-second eccentric contraction.
Alright, so for this next phase, we're going to be doing isolation of the glute med. So Fallon, what you're going to do here is you're going to have a resistance band around your ankles. And first of all, you're going to step out, and then as soon as you land, you're going to externally rotate the hip, and then you're going to go back the other way, externally rotate the hip. So, here we go. So out and externally rotate that hip. Good job. And opposite side. Awesome job. So Fallon's just going to keep doing this for 10 to 15 reps. We chose 14. And we're going to do 2 sets on each side. So good job. Do you feel that there in the building?
I do.
Awesome.
This is phase 4 of integration. In the final stage of the continuum, the following client will participate in an integrated exercise called the 180 jump to utilize the whole body, working to enhance functional capacity of the human movement system. This integrated exercise uses little to no load in a controlled manner to ensure the kinetic chain is in proper alignment. 1 to 3 sets is normally applied. This exercise will utilize a 3-set count. Repetitions of 10 to 15 are normally applied. The 180 jumps will utilize a 12 repetition count. Normally, a frequency of 3 to 5 times per week is applied. In the proposed program, 4 days per week is used, and the duration of the movement should be slow and controlled.
To finish off the continuum, we're going to be doing the integrate phase. So we are going to be doing the 180 jump, which is going to activate the TFL and glute med, and pretty much everything in the lower extremity. So what we're going to do is we're going to start here, and then Fallon is going to jump 180 degrees, and she's going to jump back. We're going to do this 12 times, and then she's going to go the other way. So then she's going to start this way and jump back like that. So this way, so good. And back. Good job. So we're going to do 2 sets of this. So we're going to do 3 sets of this. And what we're going to be doing, so Fallon, slow it down a little bit there. And you're just going to be doing a slow and controlled movement. Good job.